Bismillahirrahmanirrahim. My name is Dr. Arshad, and today my topic of presentation is International Nutrition Programs and Organizations under supervision of Professor Dr. Saira Afzal. In this presentation, I shall be explaining the various international nutritional programs combating nutritional deficiencies, the goals, achievements, Nutrition International, what it's doing at what levels, UNICEF, USAID, and some recent updates with an MCQ session at the end. Therefore, at the end of the presentation, the participants will be able to describe different nutritional programs across the globe, their challenges, achievements, and contributions for combating various nutritional deficiencies. So there is a concept of there is a need for the global health nutrition, and a global nutrition is a comprehensive look to the nutritional status and determinants across various populations around the world. While undernutrition is a predominant in low-income and developing countries, overnutrition is more common in high-income countries and populations. So the problems related to nutrition varies from population to population. Hence, the countries design their nutrition programs and their policies according to the needs and according to the problems prevailing in the society. There are several international organizations that are working at different levels around the globe and are working to combat these nutritional deficiency problems around the world. The major ones that are working at international levels are the World Health Organization, the Food and Agriculture Organization of United Nations, the United Nations Children Fund known as UNICEF, Nutrition International, USAID, and many other corporations that are working towards these objectives. Mainly, these are working to aid the members countries by helping them to identify their food and nutritional problems, also assist them to improve the nutritional situations and nutrition and food service to determine the nature and importance of the problems according to the needs. So there are also some measures that are being taken at both government and at national level, at international levels, at government level, and also at district levels where the systems run and these programs are implemented. So these organizations are taking measures to run programs for setting up nutrition units, ministries of health, coordinating bodies at highest government levels, training programs, elaborated food policies are being implemented at national level, and promoting more efficient system of production and distribution of food products. Evaluation and reporting is the part of this whole system, and this is used for establishing the guidelines for which the guidelines then can be used at national level, at international levels, for improving the nutritional status and for improving the whole this problem, different nutritional problem prevailing. For example, there can be specific guidelines on protein requirements, on nutrient requirements for specific age or for gender or for specific conditions like pregnancy. So these are all the interventions that are being done. So there are also some of the activities. For example, there can be protein calorie malnutrition, protein rich food programs, milk conservation, supplementary food programs, applied nutritional programs, or training and development of food planning and activities. So there are also some NGOs working at global level or international level, like like Helen Keller, the Save the Children, GAIN, Global Alliance, Melinda Gates Foundation, etc. These are all working at international levels. And also there are research institutes that are also working on different levels, like there is a food policy research, WBHNA, World Public Health Nutrition Association, and etc. that are also contributing to the research and new discoveries related to food nutrition problems around the world. These are some of the agencies that are specifically working at US government. So these are all included as a major part of these international agencies. And there was a huge problem in year 2020. So some of the meetings and some of the conferences were delayed, and there was a new concept of year of action that was launched on 14th December 2020. And it included several governments like Canada, Bangladesh, including Pakistan, and pledged more than 3 billion in financing commitments and recommitments related to this nutrition for growth that is supported by these US agencies. So there has been a concept for the nutritional interventions that are done at different levels to improve this whole nutritional deficiencies and nutritional problems around the world. So what are the direct versus indirect interventions? The direct nutrition interventions are nutrition specific. For example, these addresses the more immediate determinants for undernutrition like quality of diet and exercise, and they are put in three categories, like increasing the intake of minerals and vitamins, providing specific therapeutic feedings, and promoting good nutritional practices. So these all are the direct interventions that can be done by these organizations at different levels, but the indirect interventions are nutrition sensitive, that addresses the underlying determinants of undernutrition, including the food availability and water and sanitation issues related to hygiene. And they are the part of these multi-sector programs. For example, if there is a food security program, education and health, so these are integrated with these programs, and different interventions are done at different levels. There are several programs that are being run under these, and interventions are being done for improvement of the nutrition. There are supplementary feeding programs, as well as there are applied nutrition programs. So the supplementary feeding programs are like, for example, distribution of the milk powder, free milk powder for free distribution in public health centers, or it comes a direct intervention with milk supply that is fortified with vitamin A and vitamin D. Also, the distribution of milk for that better in general, and always with the nutrition education activities, like it's a direct intervention, supplementary feeding programs. And the organization have assisted, for example, an organization have assisted many countries in developing the plants for pasteurization, sterilization, and drying of milk. Other examples are like the blended cereals that can provide high calorie food to the malnourished children, high energy protein biscuits availability. These are all examples of how we can do the direct intervention and provide supplementary programs parallel. There are also protein rich food programs specifically for addressing the protein energy malnutrition, or other several malnutrition forms that has been an important problem for the last decade in our world. So applied nutrition programs are conceived, are coordinated educational activities of different departments, like of agriculture department, health and education department, and purpose of raising the nutrition level of local population, for example, in a rural area. So these are the applied nutrition programs that run in coordination with the educational activities. These are some of the examples that are being run, uh, um, and most of them are being run in India. So since we are considering the international level, so we can consider these as an applied nutrition programs. Like midday meal program is a very popular program which provides free meals to the people at specified centers. Wheat based nutrition programs, national goiter control program, and etc., where the awareness is also raised, and where as specific lectures are also provided at schools, at other institutes, and then the nutritional aid is also provided. For such programs, there has been a center of attentions like primary schools, like agriculture centers, like MCH centers, and women clubs, and at a coordination is being done at different levels of government and non-government agencies. So there has been a program being run by UNICEF, that is the ready to use therapeutic food. and that is mostly being focused on the countries with extreme malnutrition, like mostly in African regions and other parts of the world. So this actually is a packaged food that provides up to 500 calories, and it has a 2 years shelf life, and it's a ready food, and there is no need for preparation, and children can directly eat it from the packets, like milks, like peanut butters, and it's basically a mix of powdered milk, peanut butter, and nutrition, and it's a complete meal for the children. And there are several other advantages for this food, that it can be consumed easily at and age is 6 months, and since it's not water based, so bacteria cannot ruin it, and it can be safely used at home. There has also been a concept of rehabilitation centers. So the rehabilitation centers is the next step for after this ready to use therapeutic food has been implemented for the second degree malnutritions, and development of food planning activities in food technologies and home economics, and rehabilitation of children at home and at the designated institutes, where the nutrition programs is run by educating and teaching the mothers how to treat them at home. For example, a program of vitamin A fortification that was initiated in a country, and or the endemic for the endemic goiter, the iodization of the salt to control the endemic goiters. So these are the examples of rehabilitation programs. Training is also an important part, where the training of the designated personnel is important, and the interest must be shown by the government. There has also been an important role played by the Nutritional International in at both international level and also in Pakistan. So it was a Canada based. It was all started in Canada, and it's a non-profit agency, and its main actually it was aimed at eliminating the mineral and vitamin deficiencies in the developing countries. So nutrition is helps to improve nutrition children under 5, adolescent, pregnant women, and government is involved, and the general population is the target for this institute. And transforming lives to better nutrition is the motto. And working as an expert ally to the government, they combined a deep technique expertise with flexible approaches to deliver protein nutritional interventions at scale for targeting these population, especially during COVID-19 period. Some of the data that has been presented by this organization is that there is a huge problem of this vitamin E deficiency that is causing blindness. And if we provide this fortification through milk or through food, then we can reduce the incidence of diarrhea and blindness among children. 12 to 14% reduction of overall risk of death due to vitamin can be reduced overall, and 12% reduction in mortality due to diarrhea by introducing this vitamin A. For same as for the iodized salts, and iodine deficiency has been most damaging during fetal development, and many babies have been affected. So iodine consumption is critical for pregnant women and children, and these agencies are making that 70% of the households consume iodized salts. Similarly, for the iron and iron deficiency, anemia has been a huge problem, and iron deficiency is most common nutritional deficiency in the world, affecting up to 46 million people. And now and now 93 an estimated 93% countries are using fortified staples with iron. And fortified staple food with iron is important to improve the nutritional status of the population. Similarly, for the folic acid, so folic acid ensures that the women takes it during pregnancy, and it actually prevents these neural tube defects. And Nutritional International has introduced the flour and cooking oil fortification with folic acid and micronutrients to overcome this problem. And zinc has been playing an important role. Zinc and low osmolar rehydration with salts, because diarrhea has been a problem for a huge time, And now it's been shown that low or smaller zinc along low or smaller ORS along with zinc can reduce deaths from diarrhea by 93%. That's a big number. So extensive awareness regarding the use of this zinc and low osmolar dehydration must save is a cost effective treatment and can also save a huge proportion of lives. And Nutrition International has also been working in Pakistan to improve the health of women and children through micronutrient supplementation and fortification of food. Um, so there is some programs also works in collaboration with these international organizations like digitization, Pakistan's oil fortification program, that is fortifying oils with vitamin A and D. And this figure shows that 96% of the tested edible oils from the commercial oil mills in compliance with the national fortified standard must be fortified. And there has also been a check and balance at these mills, and laboratory testing is extensively done to ensure the good quality of these oils. There has been a index known as the Global Index 2021 that is internationally used by the different organizations, and it has been a nutrition initiative to actually it to see how well the nutritional programs and interventions are working at different levels of the world and the countries. And it actually monitors the food and beverages manufacturing and addresses malnutrition in all forms like obesity, overweight, nutrition, undernutrition, and micronutrient deficiencies. So the global index is used by an increased number of interested parties like policymakers, investors, international non-governmental organizations, and NGOs to hold the private sector accountable in delivering commitments to tackle growing nutritional challenges around the world. So it's a type of a public-private partnership that is being implemented and is indexing the quality, indexing and assessing the quality of the beverages, foods, and other food items that are being sold by the private sector. So UNICEF is also working at good international terms and is enhancing child and maternal nutrition all over the world. So UNICEF has an early childhood nutrition program that aims to prevent to all forms of malnutrition, including obesity, undernutrition, and overweight. And it's providing, protecting, promoting, and supporting breastfeeding. That is the major objective of this program. Also improve the first food and feeding practices for infants, like safe and affordable foods for age of 6 to 23 months and 3 to 5 years. And also to provide powdered and fortified foods to improve quality of children diets, providing micronutrient supplementation and deworming, and providing healthy food environment for having implementation of policies that are free from commercial influences. There is also a program of nutrition and care for children with wasting, and this is aimed for strengthening the health worker capacities, expanding early detection and treatment services, and making ready to use food affordable and sustainable. There has also been maternal nutrition programs where nutrition before pregnancy is focused at a large scale, whereas large scale food for fortified programs with wheat, rice, flour, and cooking oil fortification with vitamin A and D is the part of the women's diet. Also, nutrition during pregnancy is focused for weight gain, monitoring physical activity, and improving micronutrient supplementation with folic acid and iron, and also nutrition while breastfeeding. Guidelines are provided on the website where people can see the daily requirements and the increased levels during these phases of life. During nutrition of adolescent mothers and innovations of maternal nutrition is also focused under this program, providing low cost, field friendly methods to assess micronutrient deficiencies in women. So the key planned results for UNICEF for 2021 is to 250 million children are reached with this service to prevent stunting. 50 million adolescents are reached, and 6 million children are reached with service for early detection and treatment of wasting. Also, the USAID has been working. So the USAID has estimated that almost 29% globally, that 29% of children under 5 suffers from malnutrition. These figures are for America. And this agency's investment addresses the prevention of all forms of nutrition and emphasis on the target of 1,000 days window for the opportunity. And this 1,000 days windows opportunity actually focuses of children under 5 years of age with low and middle income countries, and invests nutritional investments are done by this USAID in different developing countries to improve the nutrition. So there are some of the recent advances. There has been a recently published article of building climate sensitive nutrition programs. Actually, this whole article emphasized on the fact that due to the varying climates and season variabilities in different countries, so the food systems must work closely with the climates authorities interconnectedly to focus on the needs adopted on the diet according to the climate change. And a system approach can help identify pathways through which climate influences food systems, and therefore ensuring programs combating malnutrition take climate into account. That has been seen that the climate has a role in change in feeding patterns of children as well as the adults. So this was the whole framework provided by this article. The key questions: how to make climate information service relevant, that the nutritional program on demand and supply chain in collaboration with this climate information service, and the key considerations are to: when is climate information needed, which climate variables and thresholds has an impact on nutrition, is information needed about climate in the distant or the recent past, what level of spatial and temporal details is needed, and should the information be qualitative, quantitative, or both. So this is another article that was published recently, and it was a systematic review done to see an international approach of establishing a pre-rehabilitation programs. So this systematic review was done showing that there are several factors that are kept in mind, like interventions, like including school gardens, food provisions, taste testings, cooking classes, multiple component programs, nutrition educations, and cooking related activities and gardening interventions in children willingness must be done for food preparation skill and increasing nutritional knowledge. And this review provides evidence that nutrition education programs in primary school children that are experimental in nature are most likely to be successful if they include multiple strategies and have parental involvement and focus specifically on vegetable intake. So this was the whole presentation. Now it's time for the MCQs. Now for the MCQ number 1, fortification of wheat flour with which of the following can help to reduce anemia in women and neural tube defects in an infant? Either it's iodine, it's iron, it's vitamin A, or it's folic acid.
Delta folic acid.
Yes, it's delta folic acid. Second is, which of the following would be considered as an important intervention for the public health nutrition? Collecting data on the effective interventions, calculate the number of undernourished children, fortification of food with vitamin A and D, monitor children and eating less than 2 meals a day, implement the policy for food packaging. An important intervention for the public health nutrition.
Beta.
Actually, it's C. It's fortification of food with vitamin A and D to combat the problems of vitamin D deficiencies, blindness, and other micronutrient deficiencies. Nutrition International claims that supplementation of children from 6 to 59 months with 2 doses of vitamin A per can reduce mortality of rider for how much percent? Either it's 3% reduction, 6%, 9%, or effectively 12% reduction in deaths due to diarrhea with vitamin A supplementation and rehydration therapies.
C.
It's 12% reduction in deaths of diarrhea. That is a big number. So vitamin A, showing that vitamin A supplementation is important. A micronutrient is essential for brain and development and protection from mental impairments in pregnancies and children. What steps should be taken at community level to reduce it? For impairment in pregnancy of mental impairment in pregnancies. Fortification with wheat with vitamin A, fortification vegetable with vitamin D, fortification of table salt with iodine, fortification wheat flour with iron and folic acid.
C.
Yes, C is the right answer. Fortification of table salt with iodine. Apart from all age groups, emphasis of nutrition focuses 1,000-day window opportunities because it is critical time for positive impact of child cognitive and physical. And what is that period where the child's cognitive and physical development is most affected by nutrition? Either it's the last 3 months, it's the first from pregnancy to second childbirth, first 3 years of life, first 5 years of life.
C.
It's first 5 years of life. Zinc and low or smaller ORS prevents to reduce diarrhea related to deaths. How much low or smaller can prevent death related to diarrhea? It's 33%, 53%, 73%, 93%.
B. C.
It's 93% D, yes, because it's a very cost effective method along with zinc and low or smaller, and it's very cost effective and can be easily implemented. And the percentage of deaths that can be prevented by using this intervention is 93%. So this must be implemented at all levels in every country where diarrhea is a huge problem. Which of the following micronutrients given at the community level, either with fortification or given in oral capsule forms at mass level of children under 5, helps to reduce stunting and blinding? Either it's vitamin A, vitamin B, vitamin C, vitamin D.
Alpha vitamin A.
Yes, it's vitamin A. It's a major role in stunting and blinding. Ready-to-use therapeutic foods are meant for fulfilling the nutrient deficiencies of adults, can be used for children under 6 months as breastfed milk substitute, using children 6 to 59 months treating mild malnutrition deficiencies, used for 6 to 59 months treating severe acute nutritional deficiencies.
Delta.
Yes, it's right, delta. Indirect or nutrition sensitive interventions include indirect or nutrition sensitive intervention include vitamin D supplementation, increasing crop yields, improving weaning foods, therapeutic feeding of undernourished children, and promotion of zinc in diet.
Beta.
Yes,
Beta
beta is the
increasing
right
crop
answer.
yields.
Increasing crop yields is an indirect intervention that can improve nutrition. And last is, which of the following factors have led to the recent momentum to speeding up the rate of eliminating the malnutrition? Either it's data on effective interventions, low wages, online slimming methods, improving weaning foods, or premium price of sheep at market.
E.
Actually, it's the data on the effective interventions. Evaluation and monitoring, the concept behind this is that only implementation is not important. Monitoring and evaluation of that intervention is also important. So data on the effective intervention, how it's working and it's being run is also important. And that has gained the momentum of speeding up this rate of eliminating malnutrition. Other important things are the implementation of the guidelines, as well as the implementation of protein, energy, nutrition focused programs. So since these options are not available, so data on effective intervention is the answer. So this is the key, and thank you.
Thank you very much. Very nice, Dr. Amber. Excellent presentation. And I hope everyone has learned a lot from this activity. Inshallah, this activity would continue. I would request Dr. Amber, please share the schedule of duties of telemedicine of postgraduate students. I will be highly grateful. Thank you very much. Allah Hafiz.
Allah Hafiz, ma'am.